Okay. Okay,
Great.
I'm here. Hi.
Hi, Renee. Thanks so much for taking time out of your busy schedule. I know you just had somebody that's just had a burn over there, and you're just taking care of them. So thanks so much. I always
Perfect.
appreciate your time. So yeah, I mean, what I wanted to do with this session is, what I just wanted to do with this session is to, firstly, if you could just introduce yourself, and then I think it's pretty obvious. I'm this David Durante, the CEO of MedWave. You've recently got, I think, about 2 months now. You've had our system in your practice. You're seeing a lot of different cases, a lot of chronic issues. Uh, yeah, just introduce yourself a little bit and a little bit about your background, if you wouldn't mind.
All right. Hi, everyone. I'm Sister Renee Black, recently changed to Black, used to be Sister Renee Lessing. I am a wound care specialist in Centurion. We have quite a nice big clinic in Littleton, close to Unitas Hospital. I deal with chronic wounds, very, very bad infected wounds, diabetic foot, every kind of wound with complications that you can think of. So previously, I used to work for corporate companies where I did the lecturing and clinical, work for them. So I have quite a big experience in training and then obviously in wound care. I have studied wound care with the IIWCC, the University of the Free State, and the University of Hertfordshire. So been a speaker at a few conferences, and I'm going to stop there. We don't want to waste too much time on me. So I'm very passionate about wound care and yes, very excited about MedWave.
Now, I briefly heard you talking just to one of your patients in the background there, and just the menir, it's just a beautiful way you deal with your patients is really special. So, oh, that's wonderful.
Thank you.
So what I would like to do, if that's okay, Renee, is I'm going to share my screen. You would kindly sent me a couple of photos just before and afters. I think a lot of people are wondering, like, does this sort of this red light technology, this system that you see behind me, is sort of the system that you currently have in your clinic over there. Does it work for wounds? You know, I guess that's the big thing, right? Yes. And so I wanted to share my screen real quick, and maybe you could just talk a little bit about some of the cases that you are seeing at the moment. Maybe you want to just kick us off. I just need to quickly load that onto my screen, but maybe you just want to kick us,
100%.
just tell us a little bit about some of the cases you are seeing on an
Yes.
ongoing basis.
Okay, so a very big challenge for us as wound care professionals is delayed wound healing. Patients with, compromised systems that are autoimmune, with autoimmune illnesses, diminished blood flow in the legs, and just age. Age is one of the things too. We have our body system starts working slower. There's a lot of comorbidity sometimes, and we really see a lot of wounds that basically get stuck in the inflammatory phase, and that's a spanner in the wheel for us because we want the wound to accelerate, not to be stuck in the inflammatory process. We all know that there's a whole process in wound healing, starting with the cascade, the clotting cascade, going into inflammation, then proliferation and maturation. So if that process is stopped in inflammation, we really sit with a problem with a long delay in wound healing. So that's mostly what I get here, and I must say, and that's one of the problems that we're trying to solve. And I can see a big difference already with the light because we are changing or helping the powerhouse, which is the mitochondrium, to give us, we're loading it with energy so that we can get proliferation and more cell growth in the wounds. So I also have a lot of excellent feedback on pain. Currently, you'll see one of the patients that we're going to load now and show you. I'll discuss it when we get to her. And, with pain relief, fantastic. So very, very positive feedback at this point.
That's wonderful. Thank you for sharing that. And then I think it's also all the other mechanisms of action that are taking place, like angiogenesis, increasing blood supply,
Yes.
all of that type of thing. Maybe I'll just kick us off with this first picture because I know this wasn't taken by your team, but this is something
Yes.
one of the local teams here in Jeffreys Bay. They just took a quick photo for us and see this is after one session. You can just see how much blood flow increase there's been in the skin. You can see the leg really improving. Just after one session, and this is 2 days. It was taken 2 days later, the before and the after here. But let me jump into the next one for you. I think this is one of your recent cases.
That's correct. That's correct. This is a young man. He's 18 years old, had severe wounds. This is a donor site that is just not healing. So the last part of this donor site, you can see the rest is healed very well. That is just overgranulating or hypergranulating. It's got a infection in it. You can see the bumpy tissue that's very visible. So this is after 7 days, the second photograph, which we intensively use the light on him 3 times a week for 10 minutes at about a 10 centimeter, away from the wound. And we've already got the overgranulation or the hypergranulation that's settling down. We've got, flatter granulation tissue and definitely, pain reduction because these wounds are extremely sore. So a very, very good acceleration in the process. So we're very positive about this. I'll post more photos as we go on. This is obviously an ongoing wound. The second one that we're looking at is a lady in her 80s. If you see her, you feel this foot that we're treating is ice cold. She's got dorsalis pedis pulses, not great, monophasic. And this little wound was caused by a shoe buckle that just caused a pressure injury. So it's a small pressure injury, but sometimes these wounds can take forever, especially if we've got swollen legs or edema. They're not using compression and, just all in all a cold foot. So we started with her. And we've had extremely good results with using MedWave and the light. Also, 3 times a week at a 10 centimeter distance, you can see a healthy red and actually pink. You can't see it so well on the photograph, but she's almost closed. Completely closed. Her pain, she's got arthritis in her knees. So the light we put on from her hips to her feet, and her arthritis pain in her knees have almost completely disappeared. So she loves being on the light. Okay, so excellent. The color of the foot is also improved extremely. Okay, so, all right, then we've got my newest patient currently. He burned severely, a 3rd-degree burn or a full thickness burn on his hand. He had a skin graft done. The skin graft didn't take. You can see all the hematoma and blood clots lying under that skin. We removed the skin, we removed the clots, and this is 5 days afterwards that we've got new pink tissue generating. Obviously, the skin seeded a little bit of, gave us some seeding. We just elevating that and fueling it by stimulating those mitochondriums to release fibroblasts that obviously at the end will give us some new collagen and so on in the wound bed. We also, the macrophages in the wound bed is one of the most important things in wound care because our macrophages has millions of jobs in wound care. And eventually it stimulates the collagen. In the beginning, it works like a Pac-Man, where it eats all the debris and stimulates new fibroblasts. So we're really getting excellent. The plastic surgeon is exceptionally impressed. He's not taking the patient back to theatre. We're going to heal him with a light and our dressings.
That's absolutely wonderful. And also for the patient's experience, can you talk about the VAS score on someone like this, for example?
Yeah, absolutely. We use the visual analog scale for pain assessment. His VAS started at 10 out of 10. Yesterday, he said to me, he's down to about a 4, which is absolutely amazing. His attitude has changed. He's got more trust. When they come here, they don't really have trust in us because look at my hand. We've built such a good trust relationship. And one of the biggest things, the plastic surgeon, we were on the phone last night, he said to me, you are so important in our patients that we struggle with, that we send to you because you're a psychologist, you build trust with them, the background, and eventually, you also heal the wounds for us, the ones that we are in trouble with. So it's really amazing amazing to have that, pain reduction already. That makes a patient very positive, so it's really an absolute, um, uh, say, lifesaver in this instance. So. All right, this lady, I want to talk first about antimicrobial resistance. At the moment, with the International Institute of Infection Control, globally, we are moving towards antimicrobial resistance. So, in other words, where we've got antibiotics and the overuse of that, we're also talking about that in wound care, where silvers are overused, the iodines, all these things, and eventually it's going to create resistance. So, we are very, very almost what's the English word for it? Vigilant, or in not using too much antimicrobials. So this patient came here with a severely infected, it's not even an ulcer. It started as an ulcer. She went for debridement and skin grafts. Nothing took. It was just an infected leg with a 10 out of 10 VAS score, pain score. After 9 days, this patient is not on any antimicrobials. She's on a zinc oxide bandage, and her pain has gone from a 10 out of 10 also to around a 4, and her positivity. You can also see the epithelial margins. It's sometimes difficult to see this on a photograph, but the wound color has really improved to a beautiful, healthy red granulation. We still have a little bit of fibrin infiltration. That doesn't bother us at all. That's not the same as slough. It comes out. The granulation tissue pushes it out, so we don't have to actively, debride here. The granulation tissue takes over. I always say the little spots that you see in the wound is like little rosebuds, and that's my garden. And with the help of the MedWave light, the red light, we are really increasing this granulation tissue rapidly. The other thing that I just wanted to make sure about is when you cool down a wound while cleaning it, you delay that wound with about 24 hours. There's a lot of scientific work about that. So 3 times a week, we delay the wound with 24 hours because we use cold solutions. So I've changed my protocol in the practice to using the solution cold and then adding the light for 10 minutes. And then I've got a beautiful warm wound bed that I can cover, and I haven't delayed wound healing. So I've actually accelerated it with the stimulation of the cells and not cooling it down. So we're going to get significant shorter wound treatment times.
Yes.
So there's so much to say.
Mentioned the hematoma here as well. I mean, I think it's probably one of
Yes.
the biggest obvious items on this
Yeah,
picture.
yeah, absolutely. Yeah, and this is one of our patients with a diabetic foot. He's got a Charcot foot, as you can see. The bones in the foot has completely changed shape, and it's caused a pressure wound under his foot. So this patient, we started treating him, offloading him. He's not allowed to walk on the foot, and also, getting rid of that dead tissue and skin around the wound. So within 11 weeks, we've had exceptional healing. We started with a light, and he's almost closed. He does give his absolute, he works with us very, very well. He's got, what do you call it in English? Goodness gracious, the Dutchman is coming through now. But he's really helping us by offloading, coming in for his 3 times a week treatments. We are taking away dead cells and dead skin, and we're treating him with a light. And we've been treating him for much longer before we started with the light, and it's just accelerated the healing beautifully. He's got good, healthy granulation tissue that's epitheliating at a speed now. So he shouldn't be with us for longer than another week or so.
That's wonderful. And how long would a case like the ones we've seen on screen, you take a look at this type of case, for example, how long would something like this take to sort of heal to this?
Well, in normal situations, a skin graft heals within 10 days, probably 10 to 40 days, even quicker, especially in an 18-year-old. This was obviously a delayed wound. We've had this patient for probably 2 months already, but now since we've started with a light therapy, this should take another probably 3 to 4 weeks at the most to heal. It could be much quicker. It could be 2 weeks. It all depends. And I'll keep you posted because it's very exciting to see the change that we've made.
That's
So yes,
fantastic. That's really fantastic. Thank you for sharing that. And I mean, and obviously this is quite cutting edge, right? I mean, if you think about a lot of the therapies and treatments you've been offering, been limited to some degree, and this is really taking that to. Would you agree with that? This is taking that to another level in the clinic.
absolutely. Absolutely. It's taken it to a totally different level. We can, now give patients the choice of having red light therapy or, photobiomodulation therapy. And I promise you, everybody is positive about it. It feels like we've elevated this clinic to a even more advanced clinic, and it's worthwhile. It's worth for them to pay for the treatments. We're currently busy to see if the medical aids will cover this. We have a code, so I'm sure that's going to be a question that comes up. We'll talk about it as soon as it comes up. But yes, it's elevated this clinic to a total different level.
And we're also as a company, we're more than happy to support, anybody that has questions around reimbursement and getting paid out for these and writing recommendation letters for helping write those recommendation letters as well. So if anybody needs support on that. So overall, I mean, looking at all of this, it's something that you. I mean, talk to us a little bit about how your practice now operates, because you mentioned a little bit earlier about the protocol. Do you sort of put everybody
Yes.
in the light now, or do you sort of only use it on specific circumstances?
Absolutely everybody, unless it's really, we're so busy that we can't fit everyone in. We currently see 22 to 26 patients a day, which is absolutely too much, but we can't stay ahead. We really can't fit them in other times. So it has slowed down our day a little bit because we have to now fit in 10 extra minutes, for the light. But that doesn't even, that it makes the world of a difference to our treatments and our patients, and we do that with a big smile on our faces. So it has changed our protocol a little bit. So we clean first. We then put the patient on the light, and while the patient's on the light, we discuss the light. We chat to them. We tell them how it works to make them understand, because there's nothing worse than a patient being put on a new therapy and they don't understand. So we do have to, answer all their questions and concerns, because they inevitably a very, very important part of the treatment is the patient themselves. So yeah, it has changed, but it's changed for the good.
So what I'd like to do is thank you so much for sharing all of that. I really, honestly, that has been so helpful. I wanted to briefly just say, if anybody wants to contact us, you can contact us on following information. But Sister Renee, or can we open up the floor to just a couple quick questions? I know everyone's got busy schedules, so we won't hold this meeting much longer than what we've already done. But would
Of
you
course.
taking a couple of quick questions? Is there
Yes.
anybody that's on right now that has a question for Sister Renee?
Hi, sorry, it's Nadine.
Hi, Nadine.
Trying to get my screen back again. Just a question regards the medical aid, and must the doctor specifically motivate for that? Or if we just get a general wound care motivation, we can choose to use the red light therapy if necessary.
Nadine, we're currently in the progress of sending a lot of motivations for our patients in with an extra code 88045. That's a treatment code. If like your 88002 and 88001 and 041, this is another treatment code that we started quoting. I'm waiting for feedback from the medical aids, and then obviously I'm going to charge it and see if they actually pay for it. But we have to wait for the remittances and all of that. So we are in the test phase of that. Alternatively, we tell the patients about the treatment, the value it adds to their treatment, and we tell them how much it's going to cost them 3 times a week. It's not an arm and a leg. It adds so much value to them that most of them has no problem in paying for that. So, right, but we are in the
Okay.
process. But you can try and use
Okay.
that at 045. And you're welcome to give me a tinkle if you wanted to know more anytime.
Okay, because we do phototherapy, but for neonatal jaundice. And I know often if we phone and try and get authorization, the medical aid asks, is it photobiomodulation? So I know
Yes,
it's obviously a code they have on their system. So
yes,
that's encouraging.
yes, absolutely. So I think the more of us that does that and asks for that, the better we're going to get those answers.
Thank you. All right.
You're welcome.
Fantastic. I think maybe for some people that don't know what we're talking about, I'm going to briefly share my screen with you. So I don't know if you can see this, but this is the narrow light technology panel you see here. It's on a hydraulic lift. So this lifts the panel above a bed. And so you would have your typical treatment bed, and then you literally use one button. You just push a single button like that, and the panel will come on. And then this can be adjusted. So if you want to move this around, you can absolutely just move this around like that. And then you have on here, you can lower, or I can make this go a little bit closer to the patient on the bed. So you see it's slowly lowering over there now. And that's just a remote control that how you operate this entire system. So very, very simple system. Generally, it's about 10 minutes under the light. Do you agree, Renee? It's about 10 minutes under the light
Yes,
per patient.
absolutely.
And that's generally it's a very simple, you almost can't get it wrong, right? I mean, it's so simple to use. So yeah, hopefully
Easy.
that is nice and easy to understand and to operate. And if you have different cases where maybe the patient you just want to treat the feet, you can obviously, as I mentioned, you can turn this upwards or etc. So very, very, very easy to use. So if anybody wants more information or you want to reach out to us, I'll just share my screen again. You're more than welcome to just send us an email, info@medwavegroup.com, or you can WhatsApp on 079 427 2486. So if you'd like to reach out to us, maybe grab a screenshot with your phone or something right now, and then feel free to email or WhatsApp call us. We are going to be putting together a focus group that's going to allow us to grab data nationwide on wounds and the performance of this technology on wounds. We're seeing good results pretty much everywhere. We've yet to have any bad results. There's virtually no contraindications with this technology, so it's very easy and safe to use. And so that's also another really great benefit.
David, there's one question in the text box asking, is there a smaller panel to use with patients that cannot reach your clinic? Maybe you can just answer that one.
So we don't. This is the only system that we offer. We don't sell direct to patients because we are a separate Class B and Class C device. So we don't want to sell medical devices directly to the public, and we are not allowed to. So we kind of focus on our specialties, which is a systemic treatment device. So we believe in the systemic benefit of this technology. There's a lot of other smaller devices that are like wraparound devices. They go around the knee or the face or whatever. We don't focus on that. We believe that the systemic benefits of this technology are far superior to just doing localized sort of therapies.
I think what she means is a device that she can take, because there's a lot of wound care nurses that travels to patients' homes and they treat patients at home. So I think what she meant is a smaller device that she can take from patient to patient, plug it in, treat the patient, because many wound clinics sisters don't have clinics, so they are mobile.
Yes, we have got a device that we are procuring or sort of working with some manufacturers to design a very specific device that can be used. It's handheld, but right now that's still, I would say, it's about 90 days away. So we're not there yet in actually getting that over the line yet. But I completely understand if it doesn't necessarily fit your practice. That's unfortunately we can't maybe serve you at this time. But we would recommend as well is go and find a integrative practice that you can get involved in, where they may have a room available for you to serve in once a week. or twice a week, and then just get that ball rolling. And that's probably the best way to do it. Then you'll get a lot of referrals coming from those doctors. You get a lot of referrals from, maybe physios and other people that, as you heard earlier, it's not just great for wound healing. It's great for pain reduction. People get incredible pain reduction with this technology. And then we have additional, you probably can see in the background here, we have a vibration therapy machine as well, which is fantastic for weight loss. We use a combination of these two technologies to create incredible weight loss outcomes for patients as well. And then also you get a lot of type 2 diabetics who have picked up additional weight. They need a membership program of some sort that they can keep the weight off, keep the healing benefits coming. And so between these two, we often, a lot of practices will actually purchase both of these units just also for the lymphatic drainage, bone density, increase in circulation that comes with the whole body vibration therapy technology that we offer as well. So yeah, we unfortunately right now we are clinic specific. We don't offer anything that you can use at home or take with you mobile as yet. This can wheel, this system over here and that system over there, they both have wheels, so they can move around, I would say, within a clinic. But they're not something that's mobile, and they're quite heavy. These are commercial grade machines, and so they're quite heavy to pick up, and you wouldn't be able to pick this up as an individual. So yeah, so I wouldn't recommend it.
Thank you.
Great. Thanks, everybody.
Thank you.
And I hope you have a wonderful week further, and we'll speak soon.